By understanding how the cardiovascular system works in health, we can better understand what can go wrong, why, and how we can try to prevent it. Cardiovascular disease is one of the biggest killers in the UK and worldwide. Most people consider cardiovascular disease to be a condition that affects only men, but actually it affects a similar number of men and women each year. What differs is the age at which it affects men and women and the specific types of cardiovascular disease that affect them. Lots of progress has been made in the understanding, treatment and diagnosis of cardiovascular disease, and this has led to a reduction in the number of cases over the last few decades. Looking at the statistics on cardiovascular disease provided by the British Heart Foundation in their publication Coronary Heart Disease Statistics 2012, we can see that cardiovascular disease causes 1 in 3 deaths. Cancer also causes 1 in 3 deaths, and the remaining third are thought to be due to things like injuries and infections. With nearly 180,000 people dying of cardiovascular disease in the UK each year, that's nearly 500 people per day. Looking more globally, the UK actually has a lower rate of cardiovascular disease than the EU average. Eastern Europe tends to have slightly higher rates of cardiovascular disease, whilst in Western Europe, the UK still has a relatively high level, with only Germany, Ireland, Luxembourg and Sweden having higher rates. Having said that, the UK has one of the fastest falling rates of cardiovascular disease. For those under the age of 75, cardiovascular disease rates have actually dropped by 44% in the last 10 years. The major contributing factor to this is thought to be the reduction in the major risk factors, primarily the reduction in smoking, and this is thought to account for about 60% of the reduction. The remaining 40% of the reduction is thought to be due to improvements in diagnosis and treatment. And this stems from the important research that clinicians and scientists are carrying out around the world.